They are perhaps the hardest working part of the human body, our joints. Constantly in motion, our joints help us to walk, jump, bend, lift, and perform virtually every move we make. And perhaps no other joints endure more wear and tear than the knee and hip joints. As the body's two largest joints, the hips and knees not only support a person's body weight, but must work in close coordination to provide the mobility most of us take for granted. As a result, they are easily susceptible to arthritis, injury, and other problems. Orthopedic surgeon Dr. Michael Vella explains.
The knees and hips are susceptible to many forces. First of all, they're the largest weight-bearing joints in the human body. And you're torquing or twisting at different times in different angles will put, again, torsional forces as well as weight-bearing forces on the ligaments and other structures of the knee, as well as the hip. And as a result, these forces can be multiplied 6, 10, 12 times your body weight. And therefore, they put a lot of stress across the cartilage surfaces as well as the ligamentous and tendinous structures that support and help control the joints themselves. And then what happens is your pain, your quality of life, your ability to walk, to dance, to keep up with your friends, to do things that you want, become less and less.
But living with joint pain doesn't have to be an inevitable part of aging or the result of an active lifestyle. Improving one's quality of life and managing pain can almost always be accomplished. Comprised of 30 physicians, Syracuse Orthopedic Specialists is a multi-specialty orthopedic group providing all orthopedic subspecialty care. The team of experienced orthopedic physicians excel in relieving pain, restoring function, and returning patients to their regular activities as quickly as possible.
Well, the main focus as an orthopedic specialist in adult reconstruction is preservation of function. When they get to the point where their quality of life is affected enough, then doing a joint replacement is an option, and that joint replacement is done to help them preserve their own quality of life that they desire, and it also may make them more functional and have less discomfort and lead a more normal life activity in reference to the activities they like to do.
The Syracuse Orthopedic Specialist Joint Replacement Program is one of the top programs in the region. All of the surgeons of the SOS Joint Replacement team are specialty trained, experienced, and skilled in total joint replacement.
I think we have a large role in leading the standard of care in the community. We draw from a large geographic region in this area, patients who want to come and have the best orthopedic surgery. And particularly, we've developed a reputation as the place to go to for joint replacement surgery.
In addition to their extensive residency training, each physician has undergone advanced subspecialty training and acquisition of skills in programs known as fellowships. This level of training provides each with superior knowledge and expertise in this chosen area of subspecialization. In total, these surgeons have performed more than 30,000 joint replacements in their careers.
One of our goals as a group of specialists is to be able to cover all different aspects of orthopedics. So my area of interest is joint replacement surgeons, and we have about 5 or 6 talented fellowship-trained orthopedic surgeons in that group. We also have equal numbers of doctors that are specialists in spine surgery, hand surgery, foot and ankle surgery, and sports medicine. We brought in some very talented nurse practitioners, physician's assistants. We built our own outpatient surgery center and have brought on physical therapy as one of our projects. So we now are a company of about 500 employees.
Many patients come to Syracuse Orthopedic Specialists suffering from chronic pain and limited mobility. It is the goal of each and every specialist at SOS to restore function to these individuals and get them back to living the active life they used to enjoy faster than ever thought possible.
Well, I was very active in sports, and before I had the before I had the hip replacement, I just couldn't play anymore because there was so much pain. And it was very hard getting around and stuff and things like that. And I just, it was very painful. So after I had the hip replacement, then I got back to doing the things that I could do. It would help me walk a lot more and be active a lot more than I could be before I had the hip replacement. And if I hadn't had the surgery, I probably wouldn't be able to do the job that I do now, as I work as a courier. And I have no pain. I spend a lot of time on my feet during the day. And if I hadn't had the hip replacement, there's no way that I'd be able to do it without I'd be in so much pain that I wouldn't be able to do that job now.
These renowned specialists are committed to all facets of the joint replacement specialty. They train the orthopedic surgeons of today and tomorrow, participate in clinical research, and are always on the forefront of evidence-based medicine and technology developments for joint replacement, including minimally invasive procedures, computer and robotic-guided surgery, and other cutting-edge surgical techniques and processes.
I'm thrilled to be in a situation where I'm in a practice where I can have an academic focus of training future orthopedic surgeons, as well as being involved in basic science research and clinical research. As a orthopedic surgeon in private practice, I have the advantage of being able to then apply that and provide high efficiency, and that translates into the ability to give the best quality care to the patients. We have other areas of interest. We've now started getting involved with robotic surgery as a subset of operations that we do. And it's great technology. It's a fun field to be in.
In fact, it is this commitment to the advancement of joint replacement surgical care, accompanied by the talent and skill of these surgeons, that led to the creation of Operation Walk Syracuse, an all-voluntary medical mission program providing free hip and knee replacement surgery to underserved areas of the world. They bring an all-voluntary medical team to parts of the world where knee and hip replacements are not an option. Often performing just under 100 joint replacements in 4 days during these mission trips to those who so desperately need it, Operation Walk has proven to be just as life-changing for the surgeons as it has been for the people receiving their services.
Operation Walk is a national organization. There's 13 different sites in North America. There's no more sites that are going to be developed, and you applied for a site, and a site means that you are a part of the national organization that goes around the world offering joint replacements in basically developing countries for a population that would otherwise be unable to ever get one. We can offer something that is so unique to people that have no sense of what it is. And one of the comparisons that we've made in the past is that spinal cord injury in this country is unfixable. Somebody has a spinal cord injury and they're paralyzed, they're not going to get better. We don't have the means of getting it better. And to people in countries where we go, having a joint problem is the same as having a spinal cord injury here. So arriving in those countries and offering people the ability to have a pain-free joint would be like somebody arriving here and being able to cure spinal cord injuries.
Operation Walk is a national network of 501c3 independent organizations. There's 13 in the United States, for which Operation Walk Syracuse is one. We provide free joint replacement operations for patients in the United States who don't have the means or insurance, and in foreign lands. And each year we provide about 100 joint replacements for free. This is a perfect time for us to be able to use those skills, honed over a lifetime, for something purely good, with no expectation of something in return. It's purely to feel good. So we get an incredible amount of satisfaction, equal or greater for us than what we give them, which is a new walk on life.
Diagnosis and treatment in a compassionate environment. To find out more about the physicians at Syracuse Orthopedic Specialists, or to learn more about Operation Walk Syracuse, please please visit the websites on your screen.